Arthritis is a common condition that causes pain and inflammation in a given joint. In the UK, more than 10 million people have arthritis or other similar conditions that affect the joints. Arthritis affects people of all ages, including children. CBD is incredibly popular, and there's a good possibility that some of you watching this right now have tried it already. CBD for arthritis has been looked at possibly treating the condition, but keep in mind, much more research is needed. So let's jump in and take a look at the current research available. The Arthritis Foundation conducted its own poll and found that 29% reported current use of CBD, mostly in liquid or topical form, and nearly 80% of respondents were either using it, had used it in the past, or were at least considering it. Of those using it, most reported improvement in physical function, sleep, and well-being. Of note, a minority reported improvement in pain or stiffness. If you've had arthritis, perhaps you've been intrigued by CBD. Most types of arthritis aren't cured by other treatments. Most of those treatments require medication, so some people may see CBD as a non-addictive option compared to other opiates. But is there evidence to suggest CBD works? What do experts recommend? Because of the CBD's explosion in popularity, we've been provided with a lot of research. It should be noted that there are over 100 types of arthritis, and pain is a symptom of all of them, but not all arthritis behaves the same. One treatment that works for one type of arthritis may not work for another. It's important to keep that in mind. Treatment is usually targeted at reducing pain, stiffness, and maintaining bodily function for all types of arthritis. But for certain conditions like rheumatoid arthritis, other conventional prescription medications are highly recommended because these drugs can help prevent permanent joint damage and worsening the disability. There are laboratory studies suggesting CBD may have a promising approach. Animal studies showed signs of anti-inflammatory and also pain-relieving effects. In a 2017 study, a treat containing CBD was given to rodents affected by osteoarthritis. Through the span of the study, the scientists found that the CBD product prevented the later development of pain and nerve damage in the rodents' joints with osteoarthritis. As you can see here, these aren't human studies, so it's pretty difficult to conclude anything. However, it is a good development that this could also translate to humans. CBD is also linked to improvements in pain, which is a common issue with people with arthritis. Here's one example. In the 2018 study, they found that treatments containing CBD may help treat people with chronic pain from conditions such as multiple sclerosis or other cancers. Patients and their doctors have to decide on their own whether CBD would be a viable option for them in their own specific case. If that is something you're considering doing, there are now some sensible guidelines to follow in the case that you do want to use CBD as a treatment. An article from Health Harvard goes into some do's and don'ts. Let's take a look. Number 1. If considering a CBD product, choose one that has been independently tested for purity, potency, and safety. For example, look for one that has received a good GMP certification. Number 2. CBD should be one part of an overall pain management plan that includes non-medication options such as exercise and psychological support. Number 3. Choose an oral treatment rather than inhaled products and start with a low dose taken in the evening. Number 4. Establish initial goals of treatment with a realistic period of time, for example, a reduction in knee pain that allows you to walk around the block within 2 weeks of starting treatment. Later, if improved, the goals can be adjusted. Number 5. Tell your doctor or doctors about your planned and current CBD treatment. Monitor your pain and adjust medications with your medical providers, rather than non-medical practitioners, such as those selling CBD products. Number 1. Don't make CBD your first choice for pain relief. It is more appropriate to consider it if other treatments have not been effective enough. Number 2. Don't have non-medical practitioners, such as those selling CBD products, managing your chronic pain. Pain management should be between you and your healthcare team, even if it includes CBD. Number 3. For people with rheumatoid arthritis or related conditions, do not stop prescribed medications that may be protecting your joints from future damage. Discuss any changes to your medication regime with your doctor. Keep in mind though, as with any treatment, there can be potential downsides. CBD is generally considered safe, but can also come with some symptoms like dry mouth, sleepiness, feelings of fatigue, and more. Also, there may be some confusing misinformation about potency and purity of over-the-counter CBD products. This is because CBD is classified as a food supplement in the UK and they are not regulated as a prescription like regular medication is. Also, CBD has the potential to interact with other medications, so it's important to check with your doctor. A concern has been raised by specialists in the industry. They think CBD may upset the body's natural system of pain regulation, leading to tolerance. This may be counterintuitive when treating arthritis. We talked a little about this in our video discussing whether it's possible to overdose on CBD. Another downside of using CBD as a treatment is the potential cost, as they can vary significantly. Most CBD products are inexpensive, and depending on the dose and frequency, that cost can be quite high. If you're interested in CBD treatment for chronic arthritis pain, review the pros, cons, and also the latest news regarding the matter. It also depends on the type of arthritis you have and weighing whether conventional medication may be a better option in these cases. Data isn't certain or conclusive, but studies do show that CBD oil may be beneficial for treating symptoms of arthritis. CBD appears to relieve some of the pain that may be associated with conditions such as osteoarthritis and rheumatoid arthritis. It's also important to know that people with arthritis tend to be more likely to have lower serotonin levels, which could develop to depression. CBD is claimed to have positive effects on the mood or antidepressant effects, so this could be seen as one of the healing factors for patients taking CBD as a treatment. Furthermore, whilst it wouldn't be wise to take it in place of other medications, many doctors are allowed to allow their patients to use CBD to treat their arthritis. Sure, we may not have all the evidence we'd like, but if there is a chance CBD can help improve your symptoms, you can see why customers would consider it. Just be sure to get professional advice from your doctor first, and to take the matter with a grain of salt. Well everyone, we hope you enjoyed today's video. If you're looking for CBD oil, broad spectrum that is, on our website we sell CBD balm, oil and capsules. Expect more videos to come talking about CBD oil, how you should take it, and much more. To stay up to date, make sure you hit that subscribe button and ring that bell. We'll see you next time.